Her approach to motherhood could not prevent complications during her second pregnancy, and on July 8, 1916, her daughter, Polly, was born prematurely and lived only 6 hours. In coping with her grief, Mary became even more devoted to her son.
Brecky, her son, was her hope. That was her hope for the future. She almost lives vicariously through him. He's going to go and do all the things that she, as a woman, with the limitations of her sphere, she can't do those things herself, but she can raise a young man who can go and save the world from poverty and all the problems that threaten children especially.
On January 12th, 1918, came Brecky's 4th birthday. On the 23rd of January, Brecky died. Of his swift illness and death, I cannot write, except to say that he played his part of brave soldier while conscious life remained in him. He had taken all the unaccustomed suffering, terminating his happy life without questioning why it had come, because he believed it was right for a soldier to be brave.
He was a well-cared-for child. He had a nurse as a mother. He came from a family of means. He had every advantage that a child growing up in the 19-teens could have. And he still died because death stalked families, and they stalked even families like Mary Breckinridge's.
This was devastating for her, as it would be for anybody, but for Mary Breckinridge, it was a big part of her identity to be a mother. She wrote a whole book about Brecky and his 4 years on this earth. And she decided at that time that she really needed to do something bigger than what she was doing. And she wanted to do something to serve children. She really thought that if there was better health care, her children may not have died.
She throws herself into work to also cope with her grief. And so right after Brecky's death, I think it's 12 days later, she's already corresponded with some of her nurse colleagues in the American Red Cross, and she has been granted a commission to go overseas. This is, of course, during World War I. There's a need for nurses, and as soon as Brecky dies, she says, you know, I'm available. Send me to Europe. I'll go and work there. And so 12 days later, they're telling her, yeah, we'll take you. We'd love to have someone with your skills. She spoke several languages. She was a nurse. She could be useful. And so they were ready to accept her.
Okay, so now we've watched that first clip, I'm going to hand over to Glynis, who's going to chair this event and start everything off.
Good afternoon. Hello. I'd like to welcome everybody to this from wherever you are, and thank you for joining us. I'm Glynis Meredith-Windle, and I'm the chair of the History of Nursing Group for London and the South East, a role that I've only taken up recently, so bear with me if I get a bit either carried away one way or the other. Many of you, and again, so that's what I do, and I'm actually later going to encourage you all to join the History of Nursing group, those with a nursing end, because that's part of the Royal College of Nursing, which is a membership only foundation which supports and educates nurses all over the UK. Next is going to happen, I'm going to talk to you about Zoom. Now, I hope you're all familiar with Zoom. I think over the last couple of years with COVID, we've all learned to use all these things. But a bit of housekeeping. While the talk is on, please could you mute your computers and also stop the video, because that would reduce the amount of upsets that often happen with transmissions. There will be generated captions, and I'm reading this, everybody, so if I look down, don't be surprised. And it's just, there will be use CC button if you want to turn off the automatic generated captions, but also just to reassure you that there will be an opportunity to ask questions at the end of the talks, and I'm sure they will generate a lot of questions for everybody, and it will be just a question of holding up your hand and then Sarah will talk to you. So I'm as I say, welcome again, and we're delighted to get you. But again, and I'm going to encourage anybody that has an interest in the history of nursing and is a nurse, but it's a very interesting group, and we have talks 4 times a year, quarterly, on the first Thursday of the month in every quarter. And also we don't just have talks, we invite all sorts of interesting people, but we also sometimes go to visits. So it's and a very interesting, amusing time is really had by all. But now I'm going to go on to, we've got healthcare and district nursing, both from the UK and the United States, which is fantastic. And you just saw the film about Mary Breckinridge, which was absolutely fascinating. And now I'm going to introduce you to every speaker that we have. And our first speaker is Chelsea Gorham, who's going to talk about, is going to give us an introduction. So over to you, Chelsea.
Thank you. Hello, and thanks again so much for having me join you all today. I'm so grateful for this opportunity, and especially for Chris Holm's interest in the documentary that kind of brought me to you all today. So I'm Chelsea Gorham. I am the producer, director, and writer of Angels on Horseback, Midwives in the Mountains. I work for KET, which is Kentucky Educational Television here in Lexington, Kentucky. We're a PBS affiliate with in-house production capabilities and have an extremely talented team of folks that work to create various documentaries like this one, magazine programs, educational programs, and public affairs programming. And we broadcast and serve the entire Commonwealth of Kentucky. So Angels on Horseback is the documentary. You just saw a brief clip, and we'll be seeing a few more throughout this. And I'm so happy to share it with you all. And of course, you can also stream the entire program at ket.org/angels, and I'll throw that in the chat once I wrap up here and we go on to the next thing. So I hope that you're able to stream it from wherever you are. So Angels on Horseback, of course, is the excuse me, the documentary, and it covers the founding years of the Frontier Nursing Service, which is in Leslie County, Kentucky, which is in the heart of the Appalachian Mountains. So the organization was started in 1925 by Mary Breckinridge as a demonstration to show the possibilities of rural healthcare for the entire United States. She and her nurses were able to lower the infant and maternal mortality rates to be among the lowest in the nation at that time, and they'd lost just 2 mothers in the first 12 years of operation. So very successful for their efforts in the mountains. And so the program follows Breckinridge's life experiences and motivations that led her to create the service, as well as her training abroad and the recruitment of the nurse midwives who came to help bring everything to fruition, as well as Frontier Nursing Services, once they got it established, the first decade of operation, right up until about the start of World War II, which is the event that drew the majority of her English nurse midwives back home, back overseas, and they had to start a whole new chapter with a graduate nursing education program. So Mary was 44 years old whenever she established Frontier Nursing in Kentucky. So she had a lot of life experiences that culminated into this demonstration. She was a part of a very prominent political family and spent a lot of her youth traveling with her parents and siblings between like Washington, D.C. and New York and Arkansas and Canada and Russia and Switzerland. And so that childhood kind of instilled that sense of adventure, that she applied in the mountains, and afforded her, a pretty good education for the time, especially for a female of the time, and as well as the social connections with being, kind of a socialite of her time. All of that kind of helped her to realize the Frontier Nursing Service. But we just watched a short clip about how grief was a major driver for Breckinridge. What wasn't in it prior to the loss of her children, she had lost her first husband pretty early in their marriage, and that drove her to become a nurse. And that's where she got her nursing training. But then in coping with the deaths of her 2 children from her second marriage, that's when she was kind of pushed overseas and helping a relief organization in post-World War I France. And it was there that she came to realize that the solution to the lack of rural healthcare in the United States was the combination of district nursing and midwifery as kind of this public healthcare program to treat the whole family. And so, of course, she applied what she witnessed in Scotland in the Hebrides there. And I know Chris will talk a little more about that in a bit, but she chose to demonstrate in the Eastern Kentucky mountains because of their remoteness and, the difficulty of life there. They're riding horseback for everything in those early years. She did that. She chose that to prove that if her system could work there, it could feasibly be applied anywhere in the nation and kind of solve, some of our healthcare issues, which may or may not be still happening today. But so that's kind of a brief, overview of, who I am and what the documentary is about and kind of what has brought me here to you today. So.
Okay, we're now going to play another short clip of the documentary to introduce the next talk. So this will be about the links with district nursing in the UK.
Right within the first 6 years, it's amazing to look at it because from 1925 to 1931, she built 6 rural health clinics, and in 1928 built the hospital.
The structure of the Frontier Nursing Service, it was designed to be decentralized and very much patterned off of British district nursing concepts. You had a central hospital, and then you had outpost centers spread around the county. And it wasn't just Leslie County. They weren't looking so much at county lines when determining their territory, but where people were that needed to be served and their proximity to the hospital.
Thank you. That was really interesting, Sarah. Again, more and we're moving on now to Professor Barry Grenon, who's going to talk about the UK district nursing, community nursing, up from the 19th century up to the 1920s, and she's got a vast amount of experience, which she'll tell you about. So over to you, Barry.
Thank you. Thank you, everybody. I'm really pleased to be here. I'm trying to cover a large amount of history in a very short amount of time. So I'm going to read from a script so that I stick to time. I'm going to start off by talking about what I see as quite a tangled story that's not linear, not easy to describe, and intertwined. Because I'm going to sketch a history for you, I know some of you will be really unsatisfied. Some of you will have questions and you'll think I'm missing things out. So I'm really happy to answer questions or hear further information or talk with others later. So to start my story, I've got to take you back to the mid-19th century and set the contextual scene of the first country to industrialise with rapid mass migration to the towns and cities. Here, living and working conditions for the labouring classes of all ages were appalling, as documented, amongst other, in Edwin Chadwick's Blue Books for the Poor Law Commission. So who helped at times of sickness, confinement and death? Well, for the rich, we have those services they could employ, as listed here. And at this time, in the mid-19th century, the early schools of nursing were being set up in the voluntary hospitals on the Nightingale model. And they were training nurses not just to work in hospital, but training them for private employment via the hospital. And the income from these nurses' employment was used to fund the schools of nursing. So what about our less well-off people, the class, the poor, as I've just described? Well, for those who could afford to pay, these turned to older women in their communities, known as the handy women or howdies in Scotland, who could turn their hand to care in a number of situations, delivering babies, looking after the sick, laying out the dead, helping in the house. For those that were destitute, there were the provisions of the Poor Law, and from 1834 there was indoor relief, i.e. you became resident within a workhouse, although we know that the Poor Law Guardians paid the handy women in some areas to provide outdoor relief in homes at times of epidemic. So what propels the development of organised visiting nurses for the poor? And I'd argue there are three main movements, and you may wish to add more. So the first is the sanitary and public health movement, which found momentum from the repeated epidemics such as cholera, from the documentation of mortality and morbidity statistics, and from the scientific discoveries that bacteria were the agents of specific disease rather than foul air, miasma, all of which eventually resulted in a series of new public health acts from 1848 onwards. The second movement influential to this is the growth of the philanthropic and charitable organisations which were seen as acceptable activities for middle and upper class women, linked often to religious organisations, though some were non-denominational. And finally, the movement to ensure that nurses and midwives were trained as championed by Florence Nightingale. So, against this backdrop, we start to see the experiments in providing home care nursing with sanitary education for the poor through philanthropic endeavours. And the first documented examples are instigated by the great Victorian reformer, Elizabeth Fry. It was short-lived, but others followed. And the most notable of these was in Liverpool, in which brings together strands of philanthropy, the sanitary movement, and the movement to train nurses, in particular home visiting nurses. So in 1859, William Rathbone, a wealthy merchant, philanthropist, and later Member of Parliament, set up a philanthropic experiment for training home nurses for the poor with the advice of Florence Nightingale. At the same time, creating a scheme in the city in which it was divided up into districts, each under the direction of a lady superintendent and her committee. They were responsible for finding the funds to employ and provision the nurses to care for the sick, who were poor, and to teach sanitary principles for domestic hygiene. And we can see in their statistics in the first year's reports that infectious diseases were common and that the nurses also attended childbirths. The experiment was deemed so successful that similar district nursing associations were set up in the coming years in many other cities, such as London, Manchester, Bristol, Newcastle, and spread to towns. As the century progresses, so does the movement to train nurses. And in the history of home nursing, this is manifest in the prestigious establishment of the Queen Victoria Jubilee Institute for Nurses in 1889, with a grant of £70,000 from the Queen's Jubilee Fund, secured by William Rathbone with others. It's the nucleus of a new national charity to coordinate standards of district nursing training and organisation, and it has offices in London, Edinburgh and Dublin. While this organisation was nationally recognised, not all district nursing associations wanted to be controlled or affiliated with it, and there were many other groups providing home visiting nursing for the poor, such as the Jewish welfare organisations in Manchester and London. There were also parish nurses and rural and country nurses, so a vast array, a patchwork across the country. At the same time as William Rathbone starts his Liverpool experiment, we see other experiments that lead to the group of another organised home visiting community nurse, known as the health visitors. Their development comes from the synergy between the philanthropic and sanitary and public health movements. In 1866, the Manchester and Salford branch of the Ladies Sanitary Association first employed a working class woman to visit the homes of the poor, primarily to teach about sanitary measures, as outlined here on my slide by the Leeds branch established in the same year. The Manchester branch organised on the same district principles as the Liverpool District Nursing Association, with lady superintendents, with committees responsible for fundraising and directing the work of, in this case, working class women. And these became known as health missioners and lady health visitors. So this model attracts the attention of many others, and in particular the medical officers of health employed by councils by this time, and boroughs with a remit for public health and beginning concerns about maternal and child health. And we see experiments in health visitors or lady sanitary inspectors being employed to teach the women of the poor classes about sanitary measures in the home and how to look after their children. Glasgow and Worcestershire were amongst the first councils in which they employed health visitors with this remit, i.e. using public funds, taxes, to do this. North Buckinghamshire Council was the first to provide specific health visitor training, as advised by Florence Nightingale. We also see that ladies' health committees, as described here in this slide, were established, and they begin to employ health visitors, so aside from our medical officers of health. And I'd just like to point out for you where my blue arrow is, that while the health visitors are being instructed to give hints on feeding and clothing their children, for example, and sanitary ways of looking after their homes, they're also instructed to look after sick people if they find them. So you can see the crossovers in between these types of experiments and visiting groups. And the health visitors had to either be registered, had to be trained nurses or trained sanitary inspectors and or with midwifery training. So now we turn to the 20th century. It's a period when there's a new Liberal government and they were elected on a landslide majority, and they brought in sweeping reforms such as the introduction of the old age pension in 1908 and the National Insurance Act in 1911. So I want to draw your attention to the thread of state agency in the development of the UK home visiting, nursing and midwifery services, supporting the development and quality assurance of some aspects of these services, but not others. And while the public health measures of the 19th century had improved mortality rates, the infant mortality rates, as seen in my slide here, remain unchanged. This, together with the reports on the physical deficiencies of recruits to the army for the Boer War, was reframed in terms of the jeopardy it posed to having enough fit British people to help control and defend the British Empire. As Derek Fraser, social policy historian, commented, in the bizarre way, again and again we see imperialism was linked to social reform. And the maternal and infant welfare, philanthropic and public health movements gained momentum at the turn of the century, before the First World War and during the First World War. So, if we look at our midwives, the passing of the 1902 Midwives Act and its subsequent iterations ensures only those with recognised training can legally assist in births. And by 1918, local authorities had the responsibility to supervise midwives and ensure there are adequate services. In many rural areas, they chose to do this through payments to district nursing associations. The Permissive Notification of Births Act changed in 1915, and all births had to be notified to medical officers of health within 36 hours to enable prompt visiting by trained local authority employed health visitors who could then advise on care and health of both mother and infants and promote health as well as higher levels of survival. If we turn to our health visitors, we find 600 were employed by local authorities in 1914, but by 1918, there are over 3,000 employed. One change had been made in 1914 in that the Board of Education and Local Government Board gave grants for maternity and child welfare facilities to local authorities, but also to charitable organisations. The 1918 Maternal and Child Welfare Act made it mandatory for local authorities to employ health visitors. Their policy concern continued to be about having sufficient people of the right calibre to control and defend the British Empire. And this meant their attention also turned to the health of school-aged children. Similar to the history of district nursing and health visiting, school nursing starts with experiments to provide hygiene knowledge, to identify those children with lice and other conditions that might be contagious. The 1907 Education Act introduces school medical inspections for the first time, accompanied in many local authorities by employment of school nurses to assist help and provide treatment for minor illness. Local authorities in the main use their health visitors to provide these services, or in rural areas paid for the district nurse to provide it. And lastly, to our district nursing associations, seemingly reducing in numbers through the First World War, and certainly didn't cover the whole country, as you can see here, reported by Mary Stocks in her 100 Years of History of the District Nursing. But she's here mainly reporting those Queen's nurses, i.e. those who've had training through the Queen's Nursing Institute. A major issue was that those that were trained through the First World War, just as we saw with Mary in the clip, first clip, was that they were drawn out into the military services and provision of Red Cross and other hospitals, for example. So the financial issue, I've mentioned already that local authorities were paying the district nursing associations for the provision of some type of work to the poor. And we know by 1920, 1,000 district nurses were providing health visiting services in the rural areas, as recorded by the Minister of Health, newly set up. Many district nursing associations used Provident on membership schemes, and this is what were being set up pre and during and after the First World War. And so you can see in this slide an advertisement in a newspaper for the public to pay into a district nursing local association Provident scheme. And it's not until 1929 that the Local Government Act that local authorities were permitted to provide or pay for home nursing services for the sick who were poor. As the advert shows here, the district nurse is also a midwife, and it illustrates the interconnected way these home visiting nursing services developed, particularly in rural areas, although Canvey Island, which Canvey Island is. So what I hope I've done in this brief time is sketched for you the development to the period of our Kentucky frontier services that we're focused on. I've omitted the element about the Highland and Island services. Chris is going to talk about that. What I hope I've managed to persuade you, though, is of the interconnections for the development of community nursing between the sanitary movement, the public health movement, the actions of the state, the philanthropic movements, and the movement for trained nurses and midwives. Thank you for your attention. Here are some of my sources. I'm more than happy to answer any questions later on or talk to people separately. Thanks so much.
Thank you very much, Vary. That was so interesting, and we feel that we need to go back to revisit these things at the moment in terms of community care. Next, we're going to have another clip about training in Scotland. So Sarah is going to, oh, and by the way, Chelsea, I'm so sorry. I did thank you after your talk. I was on mute if you didn't hear it, and likewise to Sarah. So I'll pay more attention. Thank you so much, though, both of you. It's just fascinating.
Once she decides that she's going to create a nurse midwifery organization, she has to be a nurse midwife. And she had the nursing training, so she goes for several months to Britain and enrolls to become a certified midwife.
She went to London. She took her midwifery training at the British Hospital for Mothers and Babies. Then she went up to Scotland, and there she met Sir Leslie Mackenzie in Edinburgh, and he was the head of the Scotch nurses, and he suggested that she should go up to the Highlands and the islands of the Hebrides and see what the nurses were doing up there.
She went to Scotland and she spent about 10 months over there touring midwifery services and public health nursing services. Scotland had the same nurse midwife model. And she got a lot of her ideas for frontier nursing service from her time in Scotland. And she made a lot of good friends there too.
Early in 1925, I came back to Kentucky.
Right. It's me again, and I'm just in a very timely way. We don't just make it up, you see. So now I'd like to introduce Chris Holm, who's actually going to talk about the Scottish Highlands services. So over to you, Chris. We can see you, Chris.
Excellent.
And hear you.
Excellent. Forgive me, technology is...
Oh, we all understand that, Chris, don't you worry.
So, yes, thanks very much. And thanks to Vari, that was, for 15 minutes, you nailed it. And thanks also to Chelsea. I thought her film was absolutely terrific, a brilliant, brilliant documentary. Anyway, hello and howdy, everybody, on both sides of the Atlantic. It didn't click with me until yesterday that howdy is also the old Scots word for midwife. So hello, hello, and howdy, howdy. So what was the Highlands and Islands Medical Service? It was a unique social experiment long before the NHS providing state-funded comprehensive care to more than 300,000 people on half the landmass of Scotland. It was set up in 1913 with a Treasury annual grant of £42,000 in the wake of a report by Sir John Dewar. Medical services were either poor or non-existent in many areas within the crofting counties. They weren't covered by the 1911 National Insurance Act, which Faris mentioned. That was for insured workers, mainly men or mostly men, in the rest of Britain. Dewar's committee started taking evidence in June 1912, submitted its final report by Christmas that year, and by August 1913, the service came into being. Funds were distributed from Edinburgh to local nursing associations to hire nurses, pay GPs a basic salary, and to local authorities for other initiatives. State resources were directed to basic needs, providing a house, telephone, car, or motorcycle, which were essential to get around in such remote areas. Like this Queen's nurse, who's Elizabeth McPhee. This was taken in 1926, rather a big motorcycle there. And Elizabeth worked, well, you can guess where she worked from, the castle of Elaine Donan in the background there. Fees were set at minimal levels, but inability to pay did not prevent people from getting treatment. By 1929, there were 175 nurses and 160 doctors in 150 practices. This is Flora Ferguson, the first motorised nurse in the Highlands. But who were these nurses? Breckinridge more accurately referred to it as the Highlands and Islands Medical and Nursing Service. That's because Queen's nurses were the bedrock and the lifeblood of the service. They were also supremely well qualified, thanks to Sherlock Holmes. Well, Surgeon Joe Bell, the inspiration for Conan Doyle's celebrated detective, worked closely with Florence Nightingale to establish nursing at Edinburgh Royal Infirmary. but later as vice president, I beg your pardon, and chair of the executive committee of the Queen's Nursing Institute in Scotland, he insisted that recruits had 3 years general hospital experience before undertaking the 6 months Queen's training for district work and 4 months for midwifery. Anyway, these were the nurses that Mary Breckinridge came to see in August 1924 at the suggestion of Sir Leslie Mackenzie, Scotland's chief medical officer and a leading member of John Dewar's committee. Breckinridge had developed the concept of the nurse midwife from her experience in France and England. What she needed was to see how this might be translated into the harsh and unforgiving challenges she faced in the sparsely populated Appalachian Mountains. Breckinridge arrived at the Institute's headquarters, where she was given a list of nurses and officials for her trip north, and off she went. By her own account, her 6 weeks in the Highlands and Islands was a joyous epiphany. Please forgive my terrible American accent when I try to quote her. North Uist had 4 nurse midwives and a doctor. It's likely that she met at least one of these. These are North Uist midwives in 1926, 2 years later, but it's likely that she met one, if not all of them. I don't know about the wee lad on the far right. I'm sure his mum must have loved him. She described Lewis as like no other part on the planet, where she was greeted with unending kindness by families living in traditional black houses. The only housing, by the way, she thought was the warmest housing she'd ever experienced in the United Kingdom. Ediskay had no doctor, but a splendid Queen's nurse midwife, Miss Martin, in whose work I was keenly interested. Her nearest physician on South Uist could reach her on call only when the seas were not too high. At Tarbet, she met Miss McLean, who served 18 scattered villages working with Dr. Ross against the elements. The winds were so terrible that bicycles were almost useless, and they had to walk miles over the moors to reach their patients. Returning to London, she did further studies in district nursing at the General Lying-in Hospital in York Road, just around the corner from St. Thomas's. This is also where Betty Lester, who features in Chelsea's wonderful film, was trained. It's now a Premier Inn, so you know where to go next time you're in London, if you can forgive them for demolishing the nurses' home to build the new bit. It promises you will sleep like a baby. Back in Kentucky, Breckinridge firmed up her plans. She needed basic demographic data for the population of Leslie County to demonstrate the impact a new service might have. Mackenzie obliged by recommending this lady, Miss Bertram Ireland, or Miss William Ina Bertram Ireland, who had conducted similar studies for him in the Outer Hebrides. This is the only photograph I can trace of Miss Ireland. She looks a really cheery soul, and this was a piece done in an American newspaper when she got the OBE from the current Queen in the current Queen's first birthday honours list in 1953. Miss Ireland, as well as her research experience, had 2 further essential qualities. She could ride a horse and take a nickname. Ireland from Scotland became the first of many. Annie McKinnon from Skye arrived soon after. Inevitably, she was given the name Mac. She was awarded the Croix de Guerre for continuing to care for the sick and wounded under enemy fire in 1918. For information, the other Croix de Guerre awarded that day went to an entire British Army regiment. Annie and Betty proved mainstays of the frontier service. Both came home in 1939 to serve in the war. Betty narrowly escaped death when a bomb destroyed a nurse's home in the London hospital she was working, and it killed several of her colleagues. Annie was severely injured when her casualty evacuation train was blown up at Newmarket. She spent 2 years recovering in hospital from a broken back. But both came back to the FNS. Their home was now Kentucky. In both services, nurses were the lead providers, largely dictated by the necessity of geography. They were embedded in the communities they served and enjoyed far more professional autonomy than their colleagues elsewhere. That brought responsibility and huge pressure of being on call 24 hours a day. This is the verdict on the big sister. The combination of doctor and nurse is extraordinarily impressive. Many of the doctors say the practice in their areas would be impossible without the services of the nurses. And everywhere we are told that cooperation between doctor and nurse leaves nothing to be desired. And the little sister. This is Irvin Loudon's comment from his book, Death in Childbirth. Irvin is, I think, the leading scholar of international maternal mortality rates. And I'll just read it. I regard this as one of the most remarkable episodes in the history of maternal and child care in the United States. There are only a few occasions when an individual established a technique or a service which had a profoundly beneficial effect on maternal care. We end with this, I think one of the most iconic photographs of a nurse ever taken. It's of Queen's nurse Katrina McCaskill in 1961. It was taken in Lochmaddy, North Uist. And Katrina is one of 20 Queen's nurses interviewed by nurse Catherine Morrison for her book based on her Manchester University PhD thesis called Hebridean Heroines, which I heartily commend here. The photographer, I actually knew the photographer, or I know the photographer, that was Dennis Strawn. He and reporter Russell Galbraith had gone up to Lochmaddy in North Uist to interview Dr. Alex MacLeod, the GP who did his rounds on horseback. The World Health Organization in Geneva saw the article in the Scotsman Weekly and was sufficiently gobsmacked to commission Russell and Dennis to go to Africa for a month to provide more of the same. Thank you.
Thank you, Chris. That was absolutely fascinating to hear that. And also the interesting thing is that the similarities that we still have with cottage community on all the islands are still, you know, no hospitals, no doctors in some of them, and helicoptering. And so it's interesting how everything first started. So that was good. Now we're going to have another clip now on nursing days. It's slightly longer than the others, just over 2 minutes, and then Chelsea's going to rejoin us.
We had this bag in which we carried all supplies that we should need for delivery, and those bags were sacrosanct. We weren't allowed to use them for anything but just the delivery itself.
And accounts by midwives of their practice do show them spending a whole weekend, 3 days even sometimes, waiting for a child to be born and not resenting it because it's part of their profession.
Women, they appreciate someone coming into the home and being with them for a period of time. The nurse midwives are able to really see, recognize, and get the kind of help that makes all the difference in the world.
If you were one of their prenatal cases, they would visit you on a regular basis long before the baby was born. And they were checking blood pressure, they were doing urine samples, they were doing everything that a woman today visiting their doctor for a prenatal visit would get. And this was not the standard of care in most places at the time. And then they'd provide care after the baby was born. Every day for 10 days they were visiting. They wanted to make sure these children grew up to be healthy adults, and so they kept very good tabs on all of their patients.
And the reason why she was able to have as lower infant mortality rates as she had is that she stressed good maternal environments for your baby, and then you will have a healthy baby. And if you have a healthy term baby, they're not likely to die in the first years of life. And her infant mortality rate was competitive with the best in the country.
For the nurses, it was a very busy lifestyle. They would get up every morning, they would saddle their horses and get ready. They would do rounds all day long and come back. They talk about very long days, because even when they got back, there were records to keep.
That was actually interesting, and I just thought something that might amuse you. Between 1984 and 88, I worked in Lesotho, which is southern Africa, and at our tertiary referral hospital, the patients used to come to us on horseback, and often it would take them 3 days because they had to get across the mountains. But that's by the way. Now I'd like to invite Chelsea back, who's going to talk about the frontier nursing system, more of her documentary, which I can't wait to hear. So over to you, Chelsea. Thank you.
Thanks. Yeah, I'll just kind of expand on a little bit of the documentary and, you know, how it came to be what it is, but then also the lives of the nurses and kind of their role in helping to build it up. But I'm so grateful for the expansions of, you know, both the British and the Scottish nursing and midwifery backgrounds. I wish that I could have expanded more in the documentary. So I've just learned so much from you both with this talk. So thank you for that. But what Breckinridge spearheaded with Frontier Nursing Service would not have been possible without, you know, the adventuresome and hardy nurses and women who came to Kentucky kind of for that adventure. You know, Betty Lester, whose voice, you know, you've heard, she remarked about, you know, whenever she was doing her training, you know, she kind of said, "Hey, I want to go to Kentucky." And they're like, "Well, do you know what you're doing there?" She's like, "Well, I just want a horse and a dog," you know, so whatever drew them there, you know, they made a huge difference once they came and really helped to, you know, build Frontier. And of course, and Chris mentioned nicknames of, you know, with Ireland of Scotland, but I'd like to point out how, you know, that kind of speaks to Breckinridge's, she had a wicked sense of humor, and it was just a great storyteller and an excellent orator, all which helped to bring everything to fruition. But because Frontier Nursing Service was a demonstration, and because Breckinridge had the means, everything was very well documented and archived, which is a documentarian's dream when it comes to everything that we had access to. You know, there were hundreds and hundreds of professional photographs where she hired photographers, including her cousin Marvin Breckinridge, who also produced a silent film called The Forgotten Frontier in 1931, and that really, you know, expanded on what the mission and goal of Frontier nursing was. But another, you know, side effect from not having government funding was needing to promote, and a way that Breckinridge would appeal to donors was by releasing quarterly bulletins, and I'll throw a link in the chat too, because those are fascinating to read through, and that's where you really get, you know, a snapshot of the nurses' lives and, you know, what they went through, you know, the adventures and you know, the harrowing and heartbreaking tales and everything, you know, riding horseback and being frozen to saddles and, you know, just the various things that they came across in Appalachia. And so those stories, you know, it really helped to see what these women were up against, but it also helped to you know, pull on those heartstrings of the donors to give and to help, you know, support and continue the healthcare. And so these nurses who came, you know, from England and Scotland and New Zealand and everywhere in between, you know, they came and they provided care to over 10,000 people, covering over 700 square miles of all, you know, all mountainous terrain. So as I mentioned, they were on horseback in all of those early years. They didn't switch over to Jeeps until I think after World War II, whenever, you know, vehicles were more readily available. But up until then, everything, you know, operated out of their saddlebags. They had, you know, special bags for doing that. Betty Lester talks a little bit about that as well. But, in their daily lives, they're saddling and maintaining the horses until the courier program was started a few years into the service, in which they brought young girls in to have an adventure in the mountains themselves. And that really helped to alleviate, what the nurses had to do on a daily basis. But, they're riding up and down the creek beds nonetheless, and, and ridges and everything to get to the patients. But then they had to do like very diligent record keeping to continue to show the demonstration and that it was successful. But the nurses were extremely professional and well-trained, of course. And they had these uniforms and everything that kind of brought them that respect. But the community ultimately, the community respected them, and they respected the community, which I think was also a big part of it. It wasn't just coming in as a helper. It was kind of that era where socialites would, hey, I want to do this or that, and they'd pop in and they'd pop back out. But what Breckinridge and her nurses did, really established something in the mountains. They weren't just doing it for show. But they were able to also keep up their British customs with tea time at Windover. They had every afternoon at 4 p.m. Everyone who was close enough would gather and do tea time and hear stories from Breckinridge or any guests that she had in the house. So I thought that was a fun. She brought a lot, from Britain and Scotland and everything that she learned there, but also kept up the customs to keep the nurses happy and perhaps more comfortable, more home-like. But the nurses, they had two nurse midwives stationed per clinic / outpost. It was in the middle of nowhere basically, and they had regular clinic days and also went out to visit homes. But they gave care, of course, under the orders of a doctor and followed medical routines. And they kind of talk about that a little bit in the documentary as well. And just kind of the conditions of the Appalachians. They were dealing with snake bites and worms and gastrointestinal issues and gunshot wounds and broken bones and everything. So it was a slew of things on top of, kind of having this frontier lifestyle. And another thing, that I was so grateful for was the oral history project that happened in about 1978, 77 to 78. A oral history fellow from University of Kentucky was able to go and capture these early nurses' voices. And so I was so happy to be able to draw on those and hear, the actual experiences from nurses like Edna Rockstroh, who was one of the early ones, and she was actually American and kind of followed the same path that Breckinridge did, and going to France post World War I, and then training as a midwife in Britain. And so she was one of the earlier ones, and so her experiences were a little tougher. But then on the other hand, you have Betty Lester, who came in 1928 and stayed until she passed away, and interrupted. Her service was interrupted by World War II. But she was, she loved Kentucky and wanted to stay. And while I have not confirmed via census records or anything, but a conversation that I had with one of the folks along the way kind of revealed that many children in the area were, took her namesake. There were a lot of little girls named Betty and a lot of little boys named Lester. So they were inspiring to the community in that way as well. But they were so successful because, and I think that one of the interviews in the past clip, which will bring us to our next clip, it talks about how they provided this, education on basic hygiene, how to keep people healthy, the preventative health care, and they gave, thousands of inoculations. I think it was 90,000 inoculations over the first, dozen years. And so, that was kind of the groundwork that they were also laying. And so they really improved the health of that, population that otherwise would not have had any health care. The hospital was, but the closest one was probably in Lexington. And, and of course, a lot of patients had to go there, even with Frontier Nursing Service, but Frontier, it was life-changing for that area, and she could not have done it without the foreign nurses that came to serve and to help. So I think, I'll toss it, or to the next clip, I guess, that I think is about educating the women.
Right. Thanks again, Chelsea. That was good. Yes, it is educating women, a subject very close to my heart in every sense of the word. So here now, I'm not sure how long this one is, the clip, but I don't think it's only about a minute. There we are.
She taught them how to work with the whole community, the importance of painting, the importance of sealing up the houses and windows, and the importance of what we call now the social determinants of health. They educated the women, and that saved a lot of children and a lot of illnesses because they knew what to do.